would you like me to take roll call?
Yes, Ryan, thank you. And I'm just going to say, and I guess everybody knows this, but in case there's anyone out there, public listening, etc., Ryan High is our Chief Operating Officer, and he will be taking roll call and acting as our executive for this meeting. Thank you, Ryan. Please take roll call.
Great. Thank you, Madam Chair. Dr. Jameson. Present. Great. Valerie Clark.
Present.
Present. Miss Levon Lewis. Absent. Dr. Cook.
Present.
Mr. Jonathan Johnson. We will mark as absent. Jose Melendres, I see present.
Present.
Mr. Quincy Branch.
Present.
Great. And then Suzanne Bierman. I will mark as absent. Commissioner Richardson.
Here.
Present. Great. And Lynette Aaron.
This is Jonathan Johnson. I don't think you could hear me earlier.
Perfect. Thank you, Jonathan. We appreciate it. Madam Chair, we do have a quorum. I think you're on mute, Dr. Jameson.
Thank you, Ryan. And we'll go on now to welcome everybody. Roll call is complete. We have a quorum, and there are no special announcements that I have to make. And at this point, we'll go right to public comment. And since we're on the web Zoom, it won't be north-south. It'll be anyone on the line. Do we have anybody? Are you aware, Katie, on public comment?
We have a lot of phone numbers on here, but no, nobody has raised their hand. Thank you.
Okay, if there is no public comment, we're going to go ahead to the first.
I'm sorry, we do have one. I apologize.
Public comment, please proceed.
Katie, it looks like they wrote in the chat feature. So if that person wants to put their public comment on the chat, or.
Yeah, I did. I sent it into the comments. Do you want me to try to paste it in, or do you want me to just say them?
Go ahead and state. I'm
Go
sorry.
ahead and state them.
Okay. And it'll just be 1 minute. Is that okay to talk for 1 minute? Hi, my name is Mindy Pretner, and I am the proud health insurance broker at Nevada HealthLink. I am fortunate to have over 800 clients, and I'm thrilled with your new website. I want you to know that the staff at Get Insured is easy to work with. The hold times are minimal, and they're great at customer service. Overall, the transition to the new site has been great from the broker perspective. The people on your staff have been super helpful, specifically Rebecca, Athena, and Ryan, open-minded and receptive to my problems. I'm sure they cringe when I call, but they're always willing to listen, which is super nice. I do have an issue I want to bring to your attention for those who make the decisions and ask for assistance in order to be proactive for open enrollment. About 2 months ago, there was a programming change that allows only one person to log in at a time into an account. There is absolutely no way that I or other brokers am going to be able to service our clients at open enrollment unless that goes back and gets fixed. So what that means is I have 800 clients. A client calls and they're like, okay, I need to upload this document, and I can't do it because if how you now have the system, When my customer service person goes and uploads it, it logs me out and it cancels me in the middle of my appointment. And I really, really, really need this fixed. The good news is that Ryan totally understands the problem and he can work with you and explain what the problem is in better detail and in words that I'm probably not using that you guys know. I would never let an unlicensed person do any sales. I can guarantee you that. But to not be able to log in two at a time is creating a massive hardship. And it will mean that I will have to substantially reduce my book of business in order to service my clients. And I know that you want us to increase our book of business, not reduce them. And so we need this problem fixed. With 800 clients in a 45-day period, I have to hold a minimum of 20 appointments a day. And if you count Thanksgiving, I'm at 25 appointments a day. I need my office person to be able to log into my account at the same time as me. This is going to create a serious impact. And so I'm really, really hoping that we only have 5 months left, that you guys get this problem fixed. We start our appointments at 7 a.m. We go every 20 minutes until 10:30 at night, 7 days a week. So please don't say, oh, they can log in when you're not on there. It won't work. We absolutely, and we're not all in the same location, especially with COVID, what's going on. So my office person doesn't know, oh, don't log in because Mindy's on. And it hangs up on the person in the middle of the appointment. This is something new that was just put into effect about 2 months ago. And I am imploring you to please fix it before open enrollment comes. So thank you very much for letting me have my 1 minute. And I'm really hoping you guys will do the right thing and get that fixed. Thank you.
Thank you, Mindy, for your input. It's very valuable and most helpful. And we definitely will be taking all of that in consideration, and the team will be right on that. Any other public comment? Can you hear me?
Not seeing any, I'm sorry. I'm kind of back and forth.
What was that? There is more public comment?
No, ma'am.
Okay, so going on to the next item of business, we have the approval of our minutes, and we have quite a few with 3 sets of minutes. We will need to be approving January 22nd, March 17th, and April 13th, and I'd like for clarity to keep each of the minutes separate for as we move for their approval. So if somebody would like to move for the January 22nd, 2020 minutes to be approved.
Valerie Clark, so moved.
Second?
Ms. Quincy, second.
Is there any discussion, edits, changes to those meetings, any minutes? Hearing none, then everybody in favor of passing the minutes from January 22nd, 2020, please say aye.
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 And the minutes from the January 22nd, 2020 meeting are passed and accepted. And now for the March 17th, 2020 minutes. I'll entertain a motion for them to be approved.
Was there a motion to approve?
Second.
Valerie Clark, second.
And any discussion, edits, comments on those minutes from March 17th, 2020? Hearing none, everybody in favor of passing those minutes, please say aye.
Aye. Aye.
Does anybody abstain or object? Object. Anyone object? No abstinence. The minutes from March 17, 2020 have been passed and accepted. And April 13th, 2020 board meeting.
Madam Chair, I make a motion to approve the April 13th board meeting minutes.
Thank you, Quincy. Do I hear a second?
Jose, second.
And Jose, and are there any comments, edits, changes? Hearing none, everyone in favor, please say aye.
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 Any objecting? Any abstinence? The minutes for April 13, 2020 board meeting are passed. So all of the 3 minutes have been accepted, and we're going to go right on to the executive director's reports. I can still hear someone talking. I think they need to mute. Oh, is that my echo? Is that me coming back to me? Oh. So the executive director's report will be presented by Ryan. Go ahead.
Okay, thank you, Madam Chair. This is somewhat of a lengthy report. This mirrors a lot of what's in the fiscal and operational report. So I will try and get through this as fast as possible, but it has a lot of information in it from the past few months here. So on January 1st, 2020, the Silver State Health Insurance Exchange officially began plan year 2020 servicing Nevada consumers as a fully autonomous state-based exchange after transitioning off of healthcare.gov. The impact of this change to consumers, insurance carriers, and exchange stakeholders is that now all functions of an SBE are solely hosted by the exchange, including enrollment, eligibility, plan selection, call center functions, quality assurance, special enrollment periods, marketing and outreach, navigator and broker relations, policy and compliance, and administrative duties of running an exchange. Nevada HealthLink, the exchange's online marketplace and brand, began the first official open enrollment period as an SBE on November 1st, 2019, and ended December 15th, 2019, with a shopping extension to December 20th for Nevadans who began their application by the December 15th deadline. A total of 77,410 consumers enrolled for plan year 2020, which included 20,111 new enrollees and 25,587 returning consumers who actively shopped on the exchange. In addition to offering consumers a new enrollment and eligibility platform, the exchange is now servicing consumers and enrollment professionals with 2 separate and dedicated phone numbers with a scalable call center. The call center is meeting all expected service levels and both the current 7-day average customer service satisfaction survey score of 100%. While offering technical enrollment support, call center staff do not provide enrollment or plan selection advice. If a consumer needs assistance enrolling and advice in selecting a plan, call center staff will refer that consumer to a licensed and trained broker or navigator. As mentioned in the fiscal and operational report, for the first time in its history, the exchange has real-time access to enrollment and plan selection data. Plan year 2020 enrollment data is the new baseline from which the exchange will work to continue to increase the number of insured Nevadans. Publication of the exchange's newly accessible data may be found in the recently produced Comprehensive Public Use File data report, which is provided to the Center for Medicare and Medicaid Services, and found that the link mentioned in the, noted in the report. Since completing its first open enrollment period as an SBE, the partnerships with CMS, the Internal Revenue Service, GetInsure's technology and call center teams, the Division of Welfare and Supportive Services, Nevada Division of Insurance, Nevada Exchange insurance carriers, licensed brokers, certified navigators, and community partners proved to be more valuable than ever. The exchange is proud to report that it has successfully tested these relationships and associated dependencies through a live open enrollment period on an independent state-based exchange platform. While the planning and preparation of the past 2 years came to fruition with a successful inaugural open enrollment period, opportunities to find even greater efficiencies with the state's valued stakeholders were revealed. As the exchange begins planning the second plan year as an SBE, the exchange continues to work with partners on enhancements such as more streamlined account transfers with Nevada Medicaid, improved reconciliation processes with insurance carriers, 1095A production with GetInsured and the IRS, promoting increased plan options with the Division of Insurance, and growing the broker and navigator grantee program with an emphasis on virtual outreach and enrollment assistance in response to the COVID-19 pandemic. Currently, the exchange is in the maintenance and operations phase of the transition project and is focusing on establishing best practices for contract monitoring for both the technology and call center functions, with an attention to defect resolution and system improvement for efficiency and effectiveness. The exchange will be making its first update to the policy manual this summer since starting as an SBE. The revised policy document will include any major updates or changes as a result of the final 2021 Notice of Benefit and Parameter NBPP, which was released in May of 2020, as well as technical enrollment and eligibility policy updates. While in the maintenance and operations phase of the plan year 2020, the COVID-19 virus pandemic hit the state of Nevada in the middle of March. The pandemic forced entire industry closures, namely gaming, hospitality, and service industries. In response to Governor Sisolak's March 12th emergency declaration, the exchange was able to quickly coordinate a limited time exceptional circumstance special enrollment period, or ECSEP, with GI to offer Nevadans who did not enroll in health insurance during the November 1 to December 15, 2019 open enrollment period, the opportunity to purchase insurance now between March 17th and May 15th. Nevadans who lost their jobs due to COVID-19 or other circumstances or experienced a qualifying life event could enroll in a new qualified health plan. Call center resources for both consumers and broker navigators were extended throughout weekends during this ECSEP. The exchange has since transitioned out of the ECSEP into the regular special enrollment period. While the project can still be considered a success through the OEP, the ECSEP, and now in the standard SEP timeline, there still remains opportunity for improvements, which will be made in 3 quarterly releases this June, September, and December of 2020. The exchange is continually working to survey and engage stakeholders in an effort to identify and prioritize opportunities for advancement, both in the special enrollment period and for the plan year 2021 open enrollment period. Just grab a quick. Moving on to the current and exceptional circumstance special enrollment period enrollment numbers. The exchange is currently in its off-season special enrollment period that typically runs from December 16th to October 31st of any given year. The exchange is showing strong enrollment numbers halfway through the year. The exchange ended open enrollment with 77,410 consumers, and as of June 23rd, 2020, the exchange has 75,917 consumers. This equates to a decrease of just about 1.9%, whereas in past years, the exchange might expect a reduction in enrollment anywhere between 10 to 15%. A unique explanation in calendar year 2020 supporting this minimal drop-off of enrollment is the exceptional circumstance special enrollment period that the exchange had running from March 17th to May 15th to assist Nevadans in getting coverage in response to Governor Sisolak's March 12th emergency declaration regarding COVID-19. The number of ECSEP applications received for the period of March 17th through May 15th was 3,999, and the number of applications that turned into enrollments was 3,252, and the total number of individual enrollees for the period was just over 5,500. A full report regarding these numbers, and complete with graphs, may be found at the link mentioned in this Executive Director's report. Now moving on to marketing and outreach. Marketing and outreach at the exchange, as will be detailed in Janelle and Patty's presentations forthcoming, is a constant year-round endeavor. Nevada HealthLink does not stop its work in reducing the number of uninsured and underinsured Nevadans in the off-cycle of the open enrollment period because of our tireless focus on special enrollment periods and consumers' year-round qualifying life events, such as someone getting married or divorced, someone moving, a change in income or job change, a birth or adoption, loss of health coverage, or turning 26. Of particular note, the strategy and planning for this year's off-season campaign shifted due to the impact of COVID-19 and the ECSEP. Janelle will expand upon how Nevada HealthLink and our marketing partner, Penta Powers, initiated a strategic ECSEP marketing campaign to inform Nevadans of the special enrollment period and inspire them to enroll at nevadahealthlink.com. Campaign messaging encouraged the uninsured and underinsured to shop and explore qualified health plans sold through Nevada HealthLink and to consider Nevada HealthLink as an alternative to COBRA plans due to a job layoff or as an interim health insurance alternative while furloughed. Now moving on to broker agent engagement. In 2019, the exchange embarked on a new process for training and certifying brokers and agents to sell qualified health and dental plans on the exchange The process was successful and the exchange is currently refreshing the program for plan year 2021. The interactive training program will still offer returning brokers and agents an abbreviated training, and new brokers a longer, more robust training. No matter if a broker takes the abbreviated or longer training, each course will teach brokers Affordable Care Act basics, privacy and security, and fraud prevention standards. In addition to providing instruction, each course will offer frequent knowledge checks to ensure content is being absorbed, as well as the final exam. Additionally, the exchange incorporated certification process attestations into the training to ensure compliance with Nevada HealthLink privacy policy, acceptable use policy, code of conduct agreement, and marketplace privacy and security agreement. As of May 2020, the exchange has approximately just under 800 resident and non-resident licensed brokers and agents who have been trained and certified on the Nevada HealthLink platform. Brokers and agents continue to appreciate the telephonic Broker Connect referral system, which is an automated telephony system that will search the phone number of a broker within the specified mile radius of a caller's location and call multiple agents until a connection is made or a message is left on the desired broker's phone. The exchange's broker liaison continues to stay in contact with licensed brokers and agents in various areas of the entire state to promote the benefits of selling plans on the exchange, to promote new features regarding the enrollment and eligibility on the GI system, and features of the broker portal and the broker book of business features. Following up on the successful request for application, or RFA, grant release in May of 2019 for plan year 2020, the exchange has released a new RFA for plan year 2021 and will award a maximum of 6 grants of $10,000 each. These grants will be awarded July 1, 2020 to insurance professionals to assist with marketing, outreach, and operational costs related to enrolling consumers in qualified health plans. While this grant is for storefront locations, the exchange is encouraging appropriate social distancing protections per state guidelines and virtual service as much as possible as the state continues to operate and mitigate the threats of COVID-19. Now moving on to navigators and in-person assisters and certified application counselors. To be compliant with federal regulations, the exchange must have consumer assistance resources and functions, including a navigator program, and must refer consumers to appropriate state resources when available. The exchange has allocated approximately $1.2 million for the year-round work performed by navigators and IPAs, and continues to operate with 2 awarded entities to serve as statewide navigators, in addition to 6 IPA entities. Navigator and IPA organizations are responsible for outreach, education, and enrollment for Nevada's uninsured and underinsured populations. While the COVID-19 pandemic is still among us, our navigators and IPAs have switched their assistance strategy from in-person outreach and education to engaging Nevada consumers through online formats such as Zoom or webinars for assistance regarding their consumer enrollment or simply just to answer their questions. The exchange has put a hold on our in-person outreach events for the time being due to social distancing mandates. Navigators and IPAs continue to educate consumers on SEPs, including the March 17th to May 15th ECSEP. This education is to assist any consumer who may experience a life-qualifying event throughout the year, along with promoting the next open enrollment cycle, which begins November 1st of this year. The exchange released a request for application in May of 2020 to provide an opportunity for current entities and new organizations to apply for a Navigator and IPA grant. The grants are in the process of being awarded, and grantees will begin their new contracts on July 1st, which is the state's new fiscal year. Now pivoting over to the Get Insured contract management. On January 1, 2020, the contract with GI transitioned from Phase 2 into maintenance and operations. For the last 6 months of state fiscal year 2020, the exchange's expected M&O costs, or maintenance and operation costs, are approximately $1 million, with reoccurring annual costs in state fiscal year 2021 of approximately $2 million. In SFY20, the exchange incurred about $227,000 in costs associated with the ECSEP, which was instituted in response to the COVID-19 pandemic. These costs included programmer hours to modify the technology platform and to accommodate the ECSEP enrollment functionality and increase call center support and hours to ensure consumers and brokers did not experience service delays during the ECSEP enrollment period. Inclusive of the cost for the ECSEP in SFY20, the exchange expects to achieve a cost savings of approximately 23% versus the federal fees associated with operation as a hybrid state-based exchange using the federal platform. Beginning in state fiscal year 21, the exchange expects to realize an annual recurring cost savings of approximately 22%, with total cost savings through state fiscal year 24 projected to exceed $23 million in total. Now, regarding call center operations, the quality assurance team at the exchange supports and works closely with the GI call center team, which has independently fielded over 79,000 calls since their operational start for the broker support line on July 26th of last year, and the consumer assistance support line on September 4th of last year. Since going live, the highest call volume at the call center was on December 13th, with over 4,500 calls offered in that single day. The call center has maintained a 90% or greater customer satisfaction rate over the length of time it's been open, and the most recent 7-day average is at 100% satisfaction. Now, regarding SBE operations, the expansive sections below detail every aspect of the operations of the exchange. It is important to note that the exchange's biannual budget included an additional 9 classified full-time employees to assist with the operationalization of the state-based exchange functionality. As the exchange is still within its first year of operation as an SBE and has yet to experience every phase of its new design and responsibilities, there are operational bridges still to cross. But thus far, the new SBE teams and staff have risen to every challenge to ensure Nevada has an SBE that is fiscally and technically sound, all the while providing exceptional service to consumer, brokers and navigators, and partner entities alike. Now, regarding policy and compliance, the policy and compliance unit consists of 1 management analyst 3, a policy and compliance manager, and 1 management analyst 1, and the policy and compliance coordinator. The new staff of the exchange's policy and compliance team have been spending time since January of this year researching, verifying, and advising internal staff, brokers and navigators, consumers, and getting assured on the finer details of enrollment policy related to eligibility and plan selection. The past few months have been tremendously busy for the policy and compliance manager. As the exchange's policy expert, the policy and compliance manager has advised all teams on the exchange on a daily basis regarding nuances of eligibility and enrollment policy to educate and help consumers, brokers, navigators, the quality assurance team, the exchange call center staff, get insured technical staff, and internal staff to arrive at the correct technical answers on questions that vary from simple to complex in nature. In order to provide this guidance, the policy and compliance manager will have to suggest small technical changes to the functionality of the GI platform and then test those changes to ensure the operation of the system is in line with the exchange policy. A prime example is that the policy and compliance manager was instrumental in quickly establishing policy and ensuring system functionality in standing up the ECSEP in response to the COVID-19 emergency. Additionally, the policy and compliance manager has been analyzing federal policy from the IRS and CMS, namely the 2021 Notice of Benefit and Payment Parameters, released on May 7th, to help create technical guides and communication materials. In support of the policy and compliance manager, the MA1 has focused some of his time recently on receiving and coordinating with the exchange's broker liaison responses to complaints received from consumers regarding questionable broker business practices. Additionally, the MA1 has assisted the policy and compliance manager with analysis of federal and state policy research, along with the writing of technical guidance, namely the Federal CARES Act, the 2021 MBPP, health reimbursement accounts, or HRAs, and overall marketplace stabilization strategies, especially in light of COVID-19. Moving on to appeals, which is also under the policy and compliance section. Since becoming a state-based exchange, the exchange has assumed the duties of consumer appeals as they relate to plan year 2020 and ongoing. The exchange oversees first-level appeals and, if applicable, sends hearings requests to the Division of Welfare and Supportive Services for adjudication. The table below highlights appeal metrics received during 2019 for plan year 2020. The information includes the number of appeals, the exchanges received by month, the resolution rate by the end of each month, and the average number of days appeals were open during a given month. And it's important to note that these numbers are terrific, but the best number is that not one appeal has gone to a hearing yet at the exchange. We've been able to informally resolve every single appeal that we've received since November of this past year. Moving on to security and reconciliation. The reconciliation team consists of two positions, the reconciliation specialist, a business process analyst, and the reconciliation lead, a business process analyst 1, and the reconciliation lead, which is a business process analyst 2. The activities of the reconciliation team are overseen by the information systems manager, who is also the exchange's information security officer. Together, these three positions comprise the exchange's security and reconciliation unit, which is collectively responsible for the monthly reconciliation of enrollment data and exchanges with the exchange's insurance carriers. Also, analysis and troubleshooting of EDI or electronic data interchange with external systems, including insurance carrier systems and the Division of Welfare and Supportive Service. They also work on user acceptance testing and coordinated release management of Nevada Health Link's exchange platform in collaboration with our technology vendor GI. They also work on annual testing of electronic data interfaces between the exchange and its insurance carriers, compilation of analysis of enrollment data to support the exchange's messaging and reporting requirements, ad hoc casework investigation in collaboration with the exchange's quality assurance team, and development and maintenance support for the exchange's carrier connector, casework and reconciliation system, which is used by the quality assurance and reconciliation teams in collaboration with insurance carrier personnel. Due to the exchange's recent transition, the Security and Reconciliation Unit has been faced with the added task of establishing regular technical meetings with the exchange's 9 different insurance carriers, and also with addressing the numerous technical issues that complicate the establishment of a new health insurance exchange. To date, the unit has investigated, logged, confirmed the successful resolution of over 12 production issues impacting Nevada Health Link Exchange platform, and it has identified, investigated, and tracked over 36 production issues impacting impacting the external systems hosted by the exchange's insurance carriers. During this time, the exchange has seen a substantial reduction in the number of monthly data discrepancies. The exchange's new reconciliation team members have been able to spend the first 6 months of plan year 2020 triangulating the most effective business processes between the exchange, carriers, and GI to reconcile and resolve electronic data interchange discrepancies regarding member and policy level data. These new reconciliation specialists lead and analyst positions have also started to provide testing support for new eligibility, enrollment, and reconciliation system updates deployed by our vendor GI. During the same time period, the Security and Reconciliation team has helped to coordinate the testing and approval of 2 major software releases for the exchange platform. And this report is being prepared, and as this report is being prepared, they are beginning to work on a 3rd major release, the largest to date for our exchange, which is scheduled for deployment in late June. Moving to the Consumer Carrier Broker and Enrollment Professional Assistance Team, our QA team, the Quality Assurance Unit was established in September of last year and consists of 3 program officer positions as quality assurance analysts. These positions report directly to the Quality Assurance Manager and overseen by the Chief Operations Officer. Each of the positions are cross-trained to ensure daily coverage and to assist with increased consumer, broker, carrier, and enrollment professional workloads, requiring escalated assistance beyond the abilities of the exchange's contracted call center. After onboarding and getting through their first OE working for SBE, the exchange's QA team has found their stride during the first 6 months of plan year 2020, resulting in the resolution of consumer and broker/navigator questions and technical issues by fostering close and deep relationships within the health insurance carriers to partner with subject matter experts who can assist to resolve issues from basic to complex in nature. In January of this year, the QA team began using a Salesforce casework product in conjunction with a reconciliation team, which is referred to as the Carrier Connector. The QA team uses this platform to collaborate with the 3 qualified health plan carriers and the 6 qualified dental carriers. The numbers below reflect cases that have been resolved, meaning closed, that were actively being worked on as of May 28, 2020, where this team has worked on over 1,900 tickets with timely resolution percentage of over 93%. Moving on to federal updates. The exchange monitors and tracks federal rule changes, court cases, and proposed legislation that may impact the way Nevada HealthLink operates. So I'll highlight just a few here of our federal updates. The first is the Individual Health Reimbursement Account Rule. In June of 2019, the Internal Revenue Service, Department of Treasury, Employee Benefit Security Administration, Department of Labor, CMS, and the Department of Health and Human Services issued a final rule to be put into effect in August of 2019 that allowed individuals to receive a health reimbursement account, or more commonly known as an HRA, from their employer to potentially utilize these benefits to purchase a subsidized health plan, or opt out of the option of the HRA and purchase a subsidized individual health plan. Individuals would need to meet all other eligibility standards to receive subsidies to use an on-exchange plan. Due to the time frame of this HRA rule, from when it was released, many states, including Nevada, the federal government and CMS were unable to create the technology in the current platform build to accommodate this rule. The exchange will continue to work with state and federal partners to incorporate this feature in future system builds. Regarding the Quality Star Rating transparency, in August of 2019, the Centers for Medicaid and Medicare Services released a rule requiring all SBEs to incorporate Quality Star ratings on plans sold on exchange when consumers are shopping. This rule was established to help provide consumers transparent ratings on the plans they chose to enroll in. Due to the time frame in which this rule was released, and with permission from CMS, Nevada did not have an appropriate amount of time to publish star ratings while shopping for plan year 2020. However, ratings were posted on the exchange's website. On April 18th of 2020 of this year, in response to the COVID-19 public health emergency, CMS allowed for flexibility for QHP issuers to not submit data that would require the exchange to publicly post the QRS ratings. For plan year 2021, the exchange will not require the collection or posting of this data. Regarding the program integrity rule, in December of 2019, CMS enhanced a published final rule related to program integrity. The rule was made final February 25th, 2020, which requires the SBE to begin biannual periodic data matching in time for plan year 2021. The additional requirements may have a financial impact for the exchange, as they will require updates to our technology platform and an additional administrative burden that may not have been previously budgeted for. The exchange is working closely with CMS and other state exchanges using the GI platform to determine the necessary timeline and the potential for shared costs. The CARES Act. In response to the COVID-19 coronavirus pandemic, Congress approved an economic recovery package, and the President signed the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act, on March 27th. The CARES Act included a recovery rebate tax credit for all citizens meeting tax and income criteria, as well as federal pandemic unemployment compensation, which is the federal unemployment income for qualifying individuals approved for state-based unemployment income. The federal pandemic unemployment compensation, FPUC, includes an additional $600 weekly UI payments for claimants. This proved to be challenging to incorporate within the exchange eligibility platform to provide consumers the best options for them. The additional funds are required to report to the exchange for eligibility and subsidies, however, not required for the calculation of Medicaid benefits. The exchange provided messaging to consumers and enrollment professionals in response to the CARES Act for informational purposes. The HEROES Act. On May 15th, the HEROES Act passed the House and is currently sitting with the Senate as of the time this report was written for a vote scheduled later this month. The HEROES Act would exempt the calculation of the FPUC additional $600 weekly in annual household income calculated to determine subsidy eligibility for the exchange. In addition, the HEROES Act is requesting an 8-week special enrollment period for the FFM and the state-based exchanges using the federal platforms. Lastly, the HEROES Act requires affordable ACA plans to cover treatment and mitigation of COVID-19 for those who are diagnosed and those who are presumed positive. Specifications related to required coverage would be provided from the Department of Health and Human Services. The exchange continues to monitor information related to the HEROES Act and is prepared to work with federal stakeholders should the act pass. The Notice of Benefit and Payment Parameters. The 2021 MBPP was finalized on May 14, 2020, and did not have any significant business process changes that directly impacted the exchange. The MBPP allows state flexibility with revisions to existing rules related to special enrollment periods. The MBPP is allowing states to adopt a new SEP to allow current exchange enrollees and their dependents who are enrolled in silver plans and become newly ineligible for cost sharing reductions to change to a QHP one metal level higher or lower if they choose. In addition, the MBPP proposed to allow states to adopt a shortened time between the date of a consumer enrolls in a plan through certain SEPs and the effective date outlined in 45 CFR 155.420. The exchange is currently exploring these flexibilities with other states that utilize the GI platform to potentially share costs associated with these changes. The MPP also alleviates the exchange from requirements under 45 CFR 155.320 regarding random sampling for employer-sponsored coverage verification for plan years 2020 and 2021. The exchange is working to adopt processes for plan years 2022 and beyond, and working with CMS to understand processes they intend to adopt. The MBPP has approved a 4.9% increase in the maximum annual limitation on cost sharing annually beginning in plan year 2021. The 2021 maximum annual limitation on cost sharings are approved at $8,550 for self-only coverage and $17,100 for other than self-only coverage. The 2020 plan year maximum annual limitation on cost sharing is $8,150 for self-only coverage and $16,300 for other than self-only coverage. And Madam Chair, that concludes my Executive Director's report.
Wow, congratulations. That, as you said, encompasses a lot of activity that has occurred at the exchange in multiple departments by many people who were cross-trained to do so many new functions, it makes your head spin. Congratulations, because as operation officer, you really did juggle a lot. And what I want to say mostly after hearing your report is, it is so impressive at the level of technology that this product has. It's not even fair to compare what we had with Xerox, but the level of this product is so amazing and so superior to virtually everything else in the country and our federal exchange. And yet, you were able in such a short period of time to download it, implement it, and despite the high technology we managed to achieve and allow people to use, the user friendliness of it is so much better than anything we've ever had. And even more, the human component, the attention you have given to every individual that has called with any problems with your call team and your troubleshooters, the human component, the care and compassion and the ability to resolve these things, and not forget that with this high technology, we must address that human component. You have far even surpassed your technology, as is seen by the amazing satisfaction survey rates. So just bravo to you, bravo. It is unbelievable, unbelievable. And I think you can appreciate that more than anyone because you're the operations officer. So, I mean, I don't know, you know, both sides, the technical, the human component, what you have achieved for the people of Nevada with this product is just amazing. And I'm going to first entertain questions from the board. Comments, questions, I could just go on talking forever. So let me go ahead and ask the other members to go ahead and state. But bravo, job well done, over the top, incredible.
All right. Madam Chair, this is Quincy Branch for the record. And again, I just want to sort of piggyback and applaud all, Ryan and the team on a tremendous job. And I guess, Ryan, there was a comment made earlier, and I forget the young lady's name who made the comment about, seems like the unforeseen circumstance of, not having the multiple logins. Has there been any other items or issues like that that maybe wasn't highlighted in your report that we just sort of found like, oh, unfortunately, okay, this happened and we're just having to fix some items, or have things been going smooth?
For the most part, I would say things are going smooth. We are definitely addressing Mindy's concerns and looking at and talking to GI about that. We're going to explore it from both a policy perspective and a technical perspective. As I mentioned, we are having quarterly updates with GI. So what they'll do is they'll have a roadmap and they will plan, these releases will happen at this point in time 4 times a year. So they'll release it, enhancements, let's say, to the eligibility and enrollment system. We'll go through, we'll test it, we'll sign off on that, and then make releases every 3 months or so. So we have this plan throughout this year and into next year. So we are definitely looking forward. Things will still come up, and we're always trying to make enhancements, but more or less the problems that we hear about are being addressed right away. GI has been a terrific partner for us that way. Yeah.
Did anyone have other questions or statements on our staff? I remember asking this very same question last year, but I apologize. In medical school, they used to say there is no such thing as a stupid question. The total last year being 77,410 consumers enrolled in plan year 2020, and the new enrollees 20,000, the returning 25,000, and the difference between that 45,000 and the 77, was that automatic, but wouldn't that be return? I got confused.
That's exactly right. So there's 2 numbers I quoted in here were the new shoppers and the returning consumers that actively shopped. The third bucket, the difference would have been just the automatic renewals. They didn't maybe actively shop. They just liked their plans and they kind of coasted through and were automatically renewed.
And again, on page 2 of your report, I just wanted to again congratulate you on the you can boast a current 7-day average consumer survey of the 100%. That is just amazing. In an IT industry, I'm just blown away by that, and it bears repeating. And when you were, this was addressed a little bit earlier, the streamlined accounts transfer, I just want to congratulate you on that. That was one of the hardest things. And I'm just happy to see that it's really basically, you continue to work on those enhancements, but that basically that was a huge stumbling block for us and that you were able to deal with that. And of course, our special enrollment period, you guys, once again, I can't tell you how much that meant to so many people in our community. And when we had the approval for this, for you guys to be able to have the flexibility, I tell all my pregnant women they have to have flexibility. You guys flexibility is your middle name, to be able to adapt so quickly to that special enrollment period and, be able to give, was that almost another 5,000 people a qualified health plan that was invaluable and affected their lives in such a positive way that words can't express it. You guys just are just doing such an excellent job. And I wanted to ask you, and that's what Quincy had talked about a little bit, a couple of places where, what were some of the specifics? What would you say? We've done this in the past, but for this last year, when you did have the complaints come in, the call center, etc., what were probably the recurrent issues that you would hear? And are there any of those that are lingering that are still a problem?
I would say, thinking back, sometimes consumers had trouble uploading supporting documentation, or they would shop for a plan maybe and think that maybe the process was over, but we would still need some information back from them to complete the their shopping experience, let's say. As far as other technical issues, I'm trying to think from a consumer perspective. Let me see. Jamie, are you on the call by any chance? She's not. I was going to rely on our policy and compliance manager, Jamie Sawyer, but she's on a different call. Let's see. As far as the broker line or the broker portal, let's say, we are exploring to move from a system that it would go from an individual broker portal situation to a agency-wide broker portal situation, where there can be more collaboration between, let's say, a broker with a larger office with more staff, let's say. It might be, it would provide better benefits for them that way. And as far as the Broker Connect, which is our telephone or telephony system where we connect consumers with brokers in their zip code or their areas, that seemed to be a favorite among brokers. I think those are the highlights. Those are the big highlights there. We just went through a patch, and the patch we just did, it was more enhancements to our technical background. We had enhancements to what we call our TAP program, which is our ticket tracking system. I know that our recon team is building a new portal to help with reconciliation with the carriers so we can identify discrepancies faster and clean those up quicker. So those are a few of the highlights there.
And I want to congratulate you because we did promise the Nevada people that going into this state-based exchange and using this wonderful new technology, Get Insured, and hiring of the extra staff and making all the changes, that we would actually save money. And I'm sure some people were skeptical that this could end up costing much more. And I just want to applaud you on your 4-year projection of 23 million. And in other words, over those several years, that we're going to save many million every year and have a better project. Do you anticipate, now that you've been through this first year and you really did your best to do it lean and mean, that as you look back as an operation officer, you see there's going to be some new positions required? Or do you think you're pretty good where you are?
We're exploring that right now, Madam Chair. You know, looking into, this is budget building season. We're getting into the summertime now, you know, in these even years, getting ready for the odd year, the legislature and the odd year. We're building those now. We're doing that analysis. We're looking at, you know, how we perform so far, and maybe is there a need, as you just mentioned, you know, because we're still one of the, if not the leanest state-based exchanges in the country. We have 22 full-time employees, and, you know, if it makes sense, asking for new positions or new resources to make the shopping experience better for Nevada consumers, that's something we're definitely exploring.
So again, as a lean machine, outstanding outstanding product and consumer satisfaction. And going on to, you were talking about how at the very end of the report, you are planning to do a couple of things and even, oh, you know what I'd ask you? You mentioned the two major software. There it is. It's on page 7. That's what I'm talking about. During this same time period, Security and Reconciliation Team has helped to coordinate the testing and approval for 2 major software releases. Is this just regarding security and reconciliation for the Exchange platform, or this is something else that they're just oversight? And then that there was a third thing coming. And what exciting changes are these? Are they going to be additional services or something to streamline what we have?
I believe it's one is to streamline what we already have. But let me see if, is Russell Cook on the line? I don't know if Russ, our IT manager, is here, if he's available to talk. And Katie, I don't know if you might have to mute him.
Lacey's on.
Hi, Ryan. This is Russell. Can you hear me?
Oh, yes, we can. Thanks, Russ. Can you speak a little bit more to that?
My pleasure. This is Russell Cook for the record. I'm the Information Systems Manager for the Exchange. The 2 major releases that were mentioned in the report refer to recently our vendor and insured has moved towards a standardized and regularly scheduled release schedule focused at quarterly releases throughout the year. So the 2 that we spoke of thus far, one of them was released in late December or early January, and then the next was our spring release, which we received in March. The third major release, which we actually just finished testing last week, and the results of which were deployed on, I believe, late Friday night of last week, represents the third in this series of quarterly releases for which the testing was overseen and coordinated by members of our security and reconciliation team. You mentioned a moment ago that many of our staff are cross-trained on a number of different functions or wear many different hats. This is certainly a great example of that. Our reconciliation team, who primarily deals with our insurance carriers in terms of ensuring that our data stays in sync with theirs and vice versa, they're a natural fit, being amongst the most IT-capable members of our staff for overseeing this testing. So that's an example of kind of double duty that they're playing. But specifically, the releases it kind of straddle the line between addressing and resolving issues which we have uncovered during our production operations. As I'm sure you're aware, no project of this scale gets deployed without a few wrinkles that need to be ironed out. We were no exception. And so our reconciliation and testing team, both through, excuse me, reports that we received from consumers or from agents or brokers that were ultimately incorporated into change requests that we submitted to get insured, combined with issues that our reconciliation team identified during the course of data interchange, normal production operations, exchanging data with our insurance carriers. These are among the sources of information that we use to identify the opportunity to fix certain defects or to enhance certain business processes within the application. So these quarterly releases then involve a certain amount of new functionality, but they are also designed to make sure that we are incorporating lessons learned along the way, and that we are essentially, patching up the things that don't work at the same time as we are implementing new features, either to address needs and requests of our stakeholders, including our brokers and consumers and insurance carriers, or else fixing issues that we have noticed with the platform. Could be eligibility related, could be behind the scenes with data interchange, account transfers with Medicaid, that sort of thing. We're always working to identify opportunities to further improve the efficiency of those operations. So I hope that helps clarify the context, but we're happy to provide some additional information if there's any particular area that I didn't address satisfactorily.
Oh, and that's what I suspected, as opposed to a lot of newer, more dynamic new services. It's really tweaking it, mostly.
Well, I do want to clarify though that you know that the ratio of fixes to new features definitely varies throughout the year, and we do focus the release each year. The release that just went live right now, as well as the next release, which will go live prior to open enrollment. Those are the releases where we really try and put the new bits of functionality in there, whereas the December release is often to do, or at least this past year was to do largely with addressing issues that were discovered during open enrollment. And then the spring release was kind of a mixture of both. We addressed some lingering issues from open enrollment, as well as some issues that were identified January, February timeframe as a result of our production operations. But one major feature that I wanted to mention specifically that has been in the works for a while, and that we are working towards implementing in Nevada, that Ryan mentioned a moment ago, is the agency portal. Right now, we have a portal that works very well for individual agents to a certain extent. As we heard earlier in the phone call, when an individual agent has a book of business of a certain size, the limitations of the platform can become a bit unwieldy. So this agency feature is designed to allow agents to essentially pass designations for broker representation amongst, to manage the distribution of those designations amongst a pool of multiple agents. One of the tricky things about enhancing the platform and responding to these requests of our stakeholders is that we always have to balance the usability of the platform within the confines of the constraints that CMS and the federal regulations that we operate under impose upon us. For instance, it is a CMS regulation that we not allow the sharing of login credentials by brokers on our platform. So that just alone imposes a certain limit to the amount of flexibility that we can afford. But, you know, kind of between ourselves and in our relationship with Get Insured, we are always trying to find ways that we can work within the confines of those regulations to increase the flexibility of the system. And I think the forthcoming agent portal is going to be a major indicator of what we mean, and will hopefully address the lion's share of what is missing now in terms of a desired level of flexibility for those brokers with a large books of business.
Wow, this sounds exciting, and I know you're going to meet the challenge, because everybody can't necessarily, but the security has to be met, so they just can't have anyone scanning documents in. They have to have a certain level of security, and yet as we get more volume, as our wonderful public comment person Mindy said, she's just going to need more of her staff to have accessibility. So you're going to walk a tightrope there between your security, privacy, how much these people have to be licensed to just get in there. But I have no doubt you will figure this out. And I just wanted to go on to where we were talking about the Quality Star rating. I thought that was very interesting, because I remember when that first came out and we were exempt this last year because we no way could have had time to qualify for that. But does it really, it looks like we won't have to do it again this year. Is that correct? Am I getting that right?
That's correct. We have an exemption for one more year.
Okay.
So we will be planning for this and we did have it posted on our website. It just wasn't, let's say, for instance, it wasn't part of a plan selection in the GI system, but that's what we'd be looking to in the future.
Right. It wasn't integrated right in the Get Insured, but they could find the ratings. So
right.
Very good. And it's so with the HEROES Act, it looks like you guys might be challenged one more time to be able to have a special enrollment period. And with the sad news of everyone reading the newspaper the last couple of days and the last weekend, in Nevada being one of the absolute highest, along with Texas, for a rise in the number of cases, it looks like you guys may have to come with your special enrollment period once again. So I'm so glad that we couldn't have a team. This is really corny, but you know, I was not a cheerleader, but a team that's on the beam. That's really up to the jive, because you guys will come up to this challenge, no doubt. And I'm so excited that you guys are going to be able to do that. Now, just want to make sure before we move on that nobody else had any questions or comments about this. Quincy, anybody, any other comments? Valerie, are you still there? I see you're high there.
I'm still here.
Okay, and you, Valerie, are often very analytical about the capacity. Any comments on your experience with your group?
No, I've been doing fine.
That's great to hear.
Yep. All is well.
So why don't we go on to the next portion, which is going to be the marketing and outreach update.
Thanks, Madam Chair. Janelle Davis for the record. Can everybody hear me? All right, cool. It's nice to see your faces. I'm going to kind of skip over a little bit because this is kind of a repeat of the fiscal and operational report. And while I am reading my report, Patty Hallebuck, our marketing agency, she's sharing her screen right now. And so you'll have some pictures and metrics to go along with my report. So that'll be a nice switch up. Okay, so as Ryan said, we are always working throughout the entire year. Our work doesn't stop in reducing the number of uninsured and underinsured Nevadans in the off cycle, and we call this our off-season campaign. So we strategize, prioritize consumer outreach and messaging efforts during the off cycle, and we continue to work to brand the organization, consistent presence and resources for consumers and stakeholders as it relates to healthcare policy and qualified health and dental plans. So the strategy and planning for this year's off-season campaign shifted dramatically, obviously due to the pandemic. In response to Governor Sisolak's March 12th emergency declaration, as you already know and what's been said, we established an ECSEP. It ran from March 17th to May 15th and obviously allowed eligible Nevada residents who missed the regular open enrollment period to enroll in a qualified health plan. So since Nevada is now operating as a state-based exchange, this was already said too, this allowed us to make a very swift policy change, which was a benefit for the exchange as well as Nevadans in need of insurance. So in response to the regulation of the ECSEP, Nevada HealthLink and Penna Powers initiated a strategic marketing campaign solely surrounded around the ECSEP. Campaign messaging encouraged the uninsured and underinsured to shop and explore the different qualified health plans through Nevada HealthLink, and to consider Nevada HealthLink as an alternative to COBRA plans, as well due to job layoff or as an interim health insurance alternative while furloughed. Additional messages to exchange consumers stressed the concept of now is not the time to cancel your health insurance coverage. And we advised consumers to reach out to their insurance carrier to see if they qualified for additional grace periods or additional subsidies to reduce those monthly premium costs. Secondarily, messaging brought awareness of the increased fraudulent activity by out-of-state brokers, messaging to Nevadans to purchase unnecessary additional COVID-19 insurance coverage. And because so many Nevadans were required to work from home, shelter at home, quarantine, the campaign incorporated television and radio, in addition to digital and an online presence, and included 30-second television and 15-second radio spots. Digital was very heavy, and then obviously paid social display ads and programmatic video, as well as over the top, which is OTT television. This reaches the streaming audience. The campaign media ran in both English and Spanish statewide. NevadaHealthLink.com's homepage and our special enrollment landing pages, also both in English and Spanish, were reworked to incorporate the ECSEP message. Additionally, we did a robust email marketing campaign that was implemented to target various niche audiences with specific related exceptional circumstance SEP messaging. Audience included the current enrollees to come back and update their change in income if it was applicable, loss of minimal essential coverage, and also to work with carriers to see if they could receive more subsidies, as well as non-enrollees seeking coverage, and then those Medicaid denied individuals or households. So moving on to public and media relations. So in collaboration with marketing vendors, the exchange developed and implemented another robust ECSEP focused PR campaign, which included identifying key media contacts with whom to make direct outreach and follow up on ECSEP messaging to offer virtual one-on-one interviews with me, the communications officer. Outlets included local radio community programs, local lifestyle TV shows, and then print and online media outlets, as well as some healthcare podcasts. Let's see, on March 23rd, Nevada HealthLink also incorporated the Affordable Care Act 10-year anniversary. And so we pushed out some messaging and a press release. The communications team also developed infographics and shared those on social channels during the week of the anniversary, in lieu of doing a press conference, because this all happened right in the beginning of the pandemic when we were all sent to work from home. Nevada HealthLink and the PR team generated multiple press releases announcing the ECSP, then announcing our extension to the ECSEP. So 2 press releases were also pushed out announcing the enrollment figures. And I believe the board received all of the metrics based on the ECSEP and loss of a minimal essential coverage. And that also highlighted regular SEP enrollments as well. And then in my report, I just list some of the PR highlights. We did a couple Vegas Inc.'s healthcare quarterlies. We were in the Nevada Independent, Reno Gazette Journal, Huffington Post, Las Vegas Sun guest column, let's see, Las Vegas Weekly, print and online, and then various PR interviews from a virtual space. All right, so moving on to outreach and community relations. In January and February, the exchange, marketing partners, navigator grantees, and broker partners continued making strides to reach the community on behalf of Nevada HealthLink. Due to COVID-19, established outreach practices, including in-person outreach, event attendance was significantly hampered or altogether canceled beginning in March. So as a result, the exchange refocused efforts toward internal email communication, collaboration with community partners and stakeholders to reach their consumer audiences, who also represent Nevada HealthLink's target audiences. And so you can just see on this slide here some of the highlights of the activities and where we dropped off hand sanitizer and educational literature. We didn't have time to actually create literature that talked about the ECSEP, but the main idea was to get people to the website to enroll in coverage. All right. Yep, and then in my report, I just kind of list out all of the different collaboration with various partners who wanted our information, and we got a really good response. Lots of different chambers, Immunize Nevada, Rapid Response. We had a lot of congressional delegation involvement, UNR, UNLV, the UMC Medical Center, and Access to Healthcare Network. In addition, we did ongoing community distribution of resource guides and SEP information through our navigator entities. We collaborated with the Exchange's Asian Community Resource Center, ACRC, to develop and distribute multi-Asian language literature for the growing Las Vegas Asian population. Development of culturally relatable Hispanic, Latino, and African American promotional concepts to use at associated events, such as quinceañeras and sweet 16s. Ongoing LinkedIn messaging campaign to human resources and management individuals in industries such as casinos, hospitality, gig workers, independent and contract workers, and associations. And then we continued collaboration with existing sponsors to creatively deliver messages to audience during and after the COVID-19 pandemic. All right, so off-season ad campaign and job loss focus. So as I said, the ECSEP campaign ran from March 17th to May 15th, after which the ad campaign segued back to promoting our regular SEP period. While overall messages focus primarily on the specifics of qualifying life events for special enrollment period and highlighting the 10 essential health benefits, a significant effort is being placed right now on promoting job loss messages to reflect the current situation in Nevada as a result of the pandemic. The ad campaign primarily utilizes digital, online, and paid social media, as well as a retooled email campaign that is consistently refreshed using Nevada HealthLink's real-time data collected now as the state-based exchange to ensure we are continuing to reach the relevant audience. Organic social media, including health-related blogs and native articles, are also an effective part of our off-season campaign. So this SEP campaign will run through September of this year. It incorporates a robust paid search effort to ensure Nevada HealthLink is the primary result for many Nevadans who are searching for health insurance online. The primary target age demographic continues to be that 26 to 45 age range, as well as a broader secondary audience who may be experiencing job loss, and of course the ongoing turnover of those who have been denied Nevada Medicaid benefits. And currently the exchange is working with Penna Powers, our marketing partner, to concept and strategize plan year 2021. So we have been presented the creative concepts for Open Enrollment 8. And we're really, hitting the ground running here, and we're all on the same page, and we're really excited to, basically launch a whole new campaign for this year's open enrollment period that starts on November 1st. And this just kind of goes over the planning objectives that we're looking at for this year. And that's the end of our report. And if you have any questions, I'm here.
Janelle, thank you. That, as always, excellent. Do you do that all along the way, or do you wait to the last minute? Because you are always so prepared, and it's so comprehensive. I'm really impressed.
The reports are a collaborated effort, and they are a long time in the making.
Any of our board members have any questions for Janelle and her coworkers, or anybody have any comments for Janelle?
Cool. Well, I guess that was pretty comprehensive. Thanks, guys.
All right. So, very good, and we're looking forward to your campaign. I agree with Quincy. Applause are in order. And let's go ahead and move into the approval of the semi-annual fiscal and operational report pursuant to the NRS 6951.3701 in parentheses B in parentheses to the governor and the legislature. And do I hear, do we want to have a bit of a presentation, or this goes straight to motion? I have no questions or comments. Do I hear a motion for the approval of the semi-annual fiscal operational report?
Valerie
moved.
Clark, so moved.
And a second?
Jose Melendez, second.
And a second by Quincy. Is, and everyone in favor, oh, any questions, concerns, edits? Not hearing any. And let's have a vote. Everyone in favor say aye.
Aye.
Aye. Aye.
Anyone not in favor? Any abstinence? Okay, then this is passed unanimously and approved. Approval of the semi-annual fiscal and operational report. Very well done. Approval of the regulations for the ability of the exchange to create an annual market stabilization special enrollment period at the conclusion of the federal open enrollment period. I think that's a great idea. Does anybody here want to make a motion for this? And there is a cover letter, and the cover letter I might share with you. The purpose of the report is to provide information to the board and public regarding new proposed regulatory language to, at the recommendation of staff and action of the board, add a marketplace stabilization special enrollment period to end of the federal open enrollment period during any given plan year. So does anybody have any questions? Well, first, if there's a motion, and we'll discuss it. Did we get the motion there? Can't
So
remember.
moved.
Second? Did I hear a second? You might be on mute. Thank you. And so are there any questions about this or comments? Okay. I'll just say I think it's a great idea again. And I would like to everyone in favor, please say aye.
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 Is there anyone opposed? And is there anybody who's abstaining? Okay, not hearing any, I don't hear any abstinence or any opposed. Then we have approval of the regulations for the ability of the exchange to create a special enrollment period at the conclusion of the federal open enrollment period. Yay. Okay. Possible action. Discussion and possible action regarding the dates, times, and agendas for future meetings. When is
Madam Chair, if I could let you know, the next scheduled meeting is October 8th at 1:30, unless determined there should be one before this time.
October 8th at 1:30. And hopefully that'll be a good date for everybody. And so, was there anybody, any of our board members, do you have any items that you would like to be placed on the agenda for that next meeting? For myself, I was very interested in hearing about the challenges when we have people with job losses and then they get on the, they get their unemployment, they get their $600 a week. And the challenges that they face when they try to do the enrollment in the special enrollment period. And then keeping in mind as we go forward again, and we have one of the highest job loss, unemployment right now, and may continue to have such, and there may be extended supplements to individuals' income in federal legislature. And I know that was a challenge, and I'd like to keep our finger on the pulse of how that's affecting people, what it does to their premium when they come on, and just these are some of our most vulnerable people that need access, and how are we all working with that? Did I kind of make that clear enough?
Yes, thank you.
Yeah, very, very, it's a dilemma. The assistance in unemployment and then affecting their overall income rate when they really need insurance, and what it does to their premiums. I'd like to kind of get a follow-up on that. Was there, because we're going to see more as we go through this year with people, as we saw our Penn of Powers are making a focus now on those people who have lost their jobs and reaching out to them to look for us, and they may have extended benefits. But other than that, was there anything else people want to see the dynamics of reported next time?
Madam Chair, this is Valerie Clark. I would just like to know if we have any prospects of any new carriers coming onto the exchange for 2021, maybe an update on carriers that we will have available on the exchange.
Excellent, excellent. And was there anything else that anybody can think of? I think that is a really good point, Valerie. And I guess that brings up the follow-up on how, for the brokers, I'd like a follow-up report on how we resolved the issue that our public comment Mindy brought to us today. Other than that, I think if I would entertain public comment now, unless there are any others. So is there any public comment? Oh, see, so not hearing any public comment?
And everyone on the phone is unmuted, so if you're on the phone and you have a comment, you can go ahead.
Sounds like our reports were pretty complete. No public comments. So I'd like to then ask for a motion to adjourn.
So moved.
We technically only need one to move, so everybody in favor?
Aye.
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 Thank you, everybody, and job well done. Outstanding, exciting, and beautiful. Thank you all, and have a great day.
Thanks, Madam Chair. Bye-bye.